And good morning, committee members and staff. I'm happy to be here today. And as you've heard already, workforce shortage is a bit of a theme today and something that the industry has experienced chronically over the last several years, and it's only been exacerbated since COVID. So staffing shortages is a challenge to all of us. The Bureau of Labor Statistics reports that the average wage for a PA direct care worker is $13.35 an hour. And that is creating a struggle to compete with other industries who are hiring the same workforce, but for starting ranges between $16 and $18 an hour. You see this everywhere, from Uber drivers, at gas stations, warehouse workforce, retail stores, and more. This work is difficult. It is both taxing mentally and physically day to day. And with fewer individuals opting for caregiver roles, providers are forced to choose who should get care that day, because there is simply not enough staff to cover the current needs for all of us. For those fortunate enough to have other supports like family and friends, a lack of staff forces loved ones to call out of work or not sleep or not care for others in their home. And that jeopardizes their own livelihoods. And it also puts the Pennsylvania economy at risk, as these family members often end up losing their jobs and utilizing even more of Pennsylvania's safety net for themselves. This creates a quality and safety concern for our clients, and it jeopardizes the program's sustainability. Our aging population in general wants to age in place. We know this. It's preferable and it avoids more costly facility settings. And when possible, which means that in-home caregivers are in high demand, and that is only growing. So our ability to pay competitive wages must be a critical priority for Pennsylvania. This becomes even more urgent when considering that neighboring states, as discussed, have reimbursement rates through Medicaid that are more than $4.50 than Pennsylvania. We cannot blame our workforce for crossing the border when able to go and do the same work that they love for much higher pay. We must enact policies that help keep jobs in Pennsylvania and support our most vulnerable population and workforce. So critical to any discussion about home care in the Commonwealth of Pennsylvania is Pennsylvania's Community Health Choices, or CHC program. This plays a significant role in how home care, home health, hospice services are delivered in the state. CHC is Pennsylvania's Medicaid managed care program for individuals who are over 21 and are eligible for both Medicaid and Medicare. The program was designed to provide an integrated and coordinated care for seniors and adults with physical disabilities. The CHC program manages long-term services and supports and home and community-based services, or HCBS. It aims to enable individuals to receive services in the home and other community settings rather than institutional facilities, which we know is more preferable, again, and of course, more cost-effective for the individual and for the state of Pennsylvania. Through CHC, the state has shifted to a managed care approach in delivering these services, with the goal of improving health outcomes, enhancing quality of care and coordination, and promoting greater access to home and community-based services, while enhancing cost predictability for state funding. For home care providers, CHC has been an important step to ensuring individuals receive care in the most appropriate setting, which we support. But it also introduces new challenges. One key issue is the sheer complexity of the program itself. With multiple MCOs operating in the program, there are varying levels of service delivery, reimbursement structures, approved processes, and this creates confusion for both providers and consumers. MCOs have different policies, procedures, and priorities, which leaves providers' concerns often lost in the shuffle. Additionally, the reimbursement rates for MCOs are most often tied to the current OLTL, or Office of Long-Term Living, fee schedule rates, which are set as a floor for rate setting for personal assistance services. MCOs often view the state reimbursement rates as reasonable and sound, as these rates are determined by the state and based off of a 2012 study that was over a decade ago, using 2011 and 2010 data. That is the rates that we are currently working with and working under. Only a handful of organizations of scale successfully negotiate rates above the floor, leaving a majority of providers unable to provide for the workforce adequately. However, it's also worth noting that CHC offers opportunities to improve care coordination and make Pennsylvania a national leader when the managed care approach was adopted. When administered correctly, this program can result in better outcomes for patients, particularly those with complex needs that require an intense amount of coordination. Overall, while the CHC program has provided an important structure for managing home and community-based services, it's still evolving and needs further refinement in order to ensure that it functions effectively with both providers and recipients, and is both funded and administered in a way that ensures these programs' longevity. In conclusion, home care is an essential and growing part of Pennsylvania's healthcare system and a healthy Pennsylvania economy. The services provided by our members not only help individuals maintain their independence and stay at home longer, but they also reduce healthcare costs by bending the cost curve and preventing unnecessary hospitalizations and institutionalizations. The Pennsylvania Home Care Association is proud to support the many agencies that provide these services, and we are committed to ensuring that the home care industry can continue to thrive and meet the needs of our aging population. As we move forward, it is crucial that we address the challenges faced by home care providers, especially in regard to Medicaid reimbursement, workforce retention, and ensuring the regulatory environment supports the delivery of high-quality care. We urge this committee to continue to prioritize home and community-based services in your discussions and to advocate for policies that strengthen and support this vital sector. Thank you all again for your time, and I look forward to working with you to ensure that Pennsylvania's home care industry continues to provide compassionate, high-quality care to all those who need it most.